what happens to the money that puts you into the black? Where does that go? Does that go to some greedy person?
No.
Well, I mean, that's the insinuation.
Yeah, we have, as level setting, we have on average now, last year, 3.2% average profits.
But what happens to the black? I mean, where does the money go? It goes to salaries, right?
It goes to salaries and administrative operations.
Could it go to reserves?
It goes to reserves. Quite a lot of those administrative operations are designed to improve health care, disease management, for example.
Can it be used to reduce premiums or otherwise for the benefit of the members?
Yes.
Here's the problem for a lot of Americans. They feel as if they have no control or no ability to impact the control of rising costs. And secondly, it seems like every time they pick up the paper, there's a healthcare executive who's making a lot of money, millions and millions, if not tens of millions, and they scratch their head and say, my rates went up, and this person's making a lot of money. I mean, do you understand that basic problem that people have?
Yes, most definitely. And I understand also that people are frustrated about the symptom, which is premiums. That's what they see. They see a bill. But that's a reflection of the underlying, it's not just cost, it's utilization, as you know, it's adverse selection, it's a range of other factors.
What I can't understand is why has your industry, for years, so aggressively spending lots of money doing it, not just using your voice, but using your dollars to oppose efforts to do just what you and I have just had a discussion about. I mean, why did we need legislation to say that you can only spend a certain percentage of your overall dollar on administration? Why did we need to even put these in place? Why couldn't you do it on your own? Why couldn't you be more transparent about profits and about pay, about what these executives have been paid? Why did we have to legislate at all, and why do we even have to have a discussion about additional legislative remedies?
Senator, I think this is a very fair question. Let me give you a very frank answer in the spirit of your question. What I think is important for the country as we talk about health care costs is assessment of profits all the way down the line. Fortune magazine says on average we have 3.2% on average. In the pharmaceutical industry, it's 25%. In the device industry, it's 11%. And we can go on and on about different stakeholder groups. This is not to castigate those groups, but just to say that, unfortunately, we've had an entire debate about healthcare insurance reform, about the insurance industry, which is 4% of healthcare expenditures, and not enough about the other 96, which is in fact driving the premiums where they are.
Mr. Chairman, I'm sorry, but I mean, I've heard the discussion about health insurer profits, and I think there's some clarity that should be added to this discussion. We regulate insurance companies at the low end of their capital levels. We do not regulate what is too much capital or surplus. A company can decide that, quote, surplus is not profit. So when a company tells you that it makes 2.2% profit, what it's telling you is a discretionary decision that's been made about how to report that number. It is not a reflection of capital received or the financial strength of that individual company necessarily.
Profit is one measure, but return on equity is another measure. You can compare them to as not only device makers and other parts, but you can, if you compare them to the manufacturing sector, insurance is doing pretty good, I think. So it's all the point of what you're comparing.